Hello guys, welcome back to our podcast. I'm your host Maureen Salim and this is Tada Kenya podcast. And today we are discussing about sexual and reproductive health. And before we get into the discussion, I have these amazing ladies and let them introduce themselves. Karibuni.
Thank you everyone. I'm Immaculate Achie. I'm a nurse by profession. I've come here to share with you my experience pertaining to sexuality and reproduction. Thank you.
Hi everyone, my name is Sheila Odhiambo. I'm a nurse by profession and I'm here for the discussion.
Hi everyone, my name is Christine Were, a staff at Tada Kenya under Health Department. Thank you.
And just before we get into the discussion, kindly give us a brief of what sexual and reproductive health is.
Okay, thanks once more. Sexuality and reproduction, actually it is majorly a state of physical, mental and emotional states of which it pertains to the relation to sexuality and reproduction. And it encompasses many aspects of life whereby we find that sometimes we experience some stigmatization when we want to address the sexuality and reproduction cases. Thank you.
If we take that direction to do with stigma and all that, do you think the community around us or generally in Kenya, do you think that the youths are well informed when it comes to sexual reproductive health?
Okay, sexual reproductive health, it's supposed to be something that people are taught even in schools, at home, but we feel there's a gap there. We feel there's a gap there because if they do not come to the health facilities to get that knowledge, it will not be instilled in them back to the community. Maybe there's still stigma, their parents cannot talk to them about it. The teachers in school feel they cannot address it, they cannot talk about it. It's still a taboo.
Just to Christine, since you're one of the programs officers that are coordinating things to do with sexual and reproductive health in schools and in communities, what's your view about the community around us? Are they well informed when it comes to sexual and reproductive health?
Well, from what I've seen in the field, I can say that they are misinformed. They have the information, but it's not the right information. They have, should I say, a stereotype or they believe that things to do with sexuality, it's only women who are mostly affected, but they do not know that men and boys also need to prioritize their sexuality and their sexual and reproductive health as well. Because when you say reproductive health, what comes to the mind is menstruation and pregnancy, and that's it. Yeah.
And back to you, Sheila and Emma. You said you're nurses. Do you get instances where some youths or some adolescents walk into your facilities and they're like they want to be informed about this sexual and reproductive health information? Have you found such instances? And if at all you found any, how can you rate it in terms of percentage? Is it like 50, 20, or maybe 100?
Okay, thank you again. For my case, where I practice, very few teenagers walk in wanting to know more about their sexuality or even family planning methods or anything. Very few. So percentage, I can rate it at 25%. Yeah.
Generally, whatever she has said, it happens also in my area where I also practice nursing. Because we find that if you do not have a youth-friendly service or a youth-friendly area where they can come and then you talk to them, you educate them on the sexuality and reproduction, you find that the percentage of these teenagers coming to you won't be rated as more than 50%. Yeah.
So Christine has talked about the traditions, the taboos and all that. Do you think it's a contributing factor to the low percentage that you receive in your facilities? And if at all you think it's the reason, and why do you think we can is it controlling or we can increase the number?
Oh yeah, it's true. We have the socio-economic issues, we have the norms, the cultural, the beliefs are there, the taboos are also there. Like sexuality, people tend to feel that it's something that is related to impurity. For those who do not for those who do not understand what sexuality in general. And then you find that for some religions, they feel that people should not go for reproduction, the reproduction method, with the family methods to be specific.
Right, some religions.
Yeah, like maybe I can mention one. I hope
No,
I won't
don't
mention.
We'll leave it at that.
And I mean, what we can add about sexuality, people are scared. People don't want to open up about their sexuality. They feel like it's something private, it's theirs. You can find maybe during, if you have those outreaches, if they come to you when they have a problem. When they have a problem, that's when they'll come. Maybe this lady is pregnant, she wants to procure an abortion, it is unwanted pregnancy. So they'll come to you, I want to procure abortion. Or they'll come to you, maybe they are having some STIs, they don't know how to deal with it, but when there's a problem, that's when they'll come. So they feel it's private, they don't talk about it, but when there's a problem, you'll see them. Yeah.
So they'll just come in when they have problems, not when they want to be informed. Back to you, Christine. Have you found instances in the community where someone comes in and they're like, you know what, Christine, I would like to know more about this family planning. Maybe I would like to know more about safe abortions and all that. Have you come across such instances?
Well, I wouldn't say yes or no, but from our interactions with the community members, we can tell that they want this information. Because you get that if it was an activity where we had both genders, the male and the female, they both have their own understanding of sexual reproductive health and rights. When women talk about sexual reproductive health and rights, especially family planning, which is a very big issue to women, you will find that they have a lot of myths and theories that hinder them from going to get family planning services in the society, from their facilities. And you get that these myths and misconceptions are instilled in them by men. Actually, they say if you go for a particular mode of family planning, it injures the man. Actually, it does, I don't know what to the woman, and I don't know what. So you see that these women, they actually want this family planning, but they can't go for them because of these myths and the theories about family planning methods.
So in some way, it's like male are not, the male gender is not included in this. So to our nurses, what's your take on that? Do you think the male gender is included in terms of sexual and reproductive health, or do you think that there is ubaguzi kiasi hapo?
Okay, male gender, all I can say is that percentage of them are engaged, and this comes because they have the education with them, they are sensitized, But for those who lack the information concerning the reproduction and the sexuality, they tend to pursue sexuality, the family methods and all that they are not good for a woman to take. For instance, I've experienced a woman who came for the family method, of which we did, and then later on the man came and said that they're not comfortable with that, they don't want it at all. So to my perception, I think male involvement is very important, and we should look on ways on how we can do it.
The male involvement, it's an issue when it comes to family planning, accessing family planning for women. But we are trying as much as we can, we usually involve them. When this lady comes for delivery, when the man is coming to get her after delivery, we talk to them together. We ask them which method they really wish to use. And when we involve these men, by then they know. That is one thing we do not put it in, in our minds. We just talk to these women alone. But when we involve these men, they usually know, and then they'll assist this woman to pick the right method that can assist her. And if there's a problem, they'll come together, those who are involved. And then we have the others who do not want these family planning methods. And the percentage is high for those who do not want women to use family planning methods. Reasons are very weird. They say when the women are using family planning, they are promiscuous. They say when women use family planning, they tend to be very thin. And other women usually come, they want a specific family planning because that family planning will make their hips broaden. Wow. So they come with that reason, you know. So you have to sit them down again, you cancel them again on every family planning method and request them to go back and talk about it with their spouses. It is not easy, but it's a challenge. It is a challenge.
Recently, I came across an article that some parents were against the sexual reproductive health subject in schools just because they felt it was just an opinion article. To some parents, they said that they are exposing their children to things to do with abortion, things to do with, let me say immorality, things to do with family planning, things to do with maybe having safe sex, because they really feel that their children are still babies, like 2 years old, like they don't want to accept the fact that they are teenagers and they should be exposed to this thing. So what's your take on that? Should these school-going kids be exposed to such knowledge, or do you think, according to you, it's something that should not be discussed maybe in schools or in open spaces?
In my opinion, discussing sexual and reproductive health in school is very essential because in schools we'll find that you have the teenagers, that is maybe even 10 to 15 years and even 15 to 24, depending on the institution. If you talk about the sexual reproductive health, they will get to know what it entails and whichever way to take for them to protect their life, to be physically fit, emotionally and mentally. Because if they are not physically fit and emotional, socially, they will be affected by other things, even diseases. But if they get to know, they have the awareness, they've been educated and sensitized, then it means that they can have a way of protecting themselves and even people that are surrounding them.
To add on that, I really wish the sexual reproductive education to be taken back to schools, because most of these children spend most of the time in school. Their parents are going to work. They'll come back maybe at even 9 when the children are now sleeping. So most of the time they're spending in schools. And empowerment is key. When they know, that's when they know how to say no. They even choose which other method they want. They even say, no, we have to go and do this and this and this and this, because they're empowered. But if they're not empowered, they cannot even speak. So violence, gender-based violence will be in the rise.
Just because you mentioned gender-based violence, April we are celebrating it's sexual assault awareness month. So how can you bring the relationship between sexual reproductive health in relation to sexual assault? In that direction.
Okay, so when we check the sexual reproductive, a woman and a man, they are two different people, yes? So we can see that the woman usually undergo menstrual period, and there are some other instances during that time, that period, the mental state is not usually stable. So this lady, maybe she has a boyfriend or she's married. So during that time, she will need support from the spouse or the partner. But now maybe the partner will not accept or will not even talk about it, especially maybe when they want to engage into sexual intercourse. This lady is on her periods, this man is busy like, no, I want it right now. That is one thing. Another thing, family planning methods. I keep on going back there. So family planning methods, this lady is on a specific family planning method, and these methods are different according to your body. You didn't bring your partner to come and discuss about it. They have different side effects. So now you've gone back, maybe you've become fat, maybe you're so thin, maybe your menses are just there all the time, you're there sexually. This man will rape you because I want it right now. No, I'm on my periods,
And they can also increase the gender-based violence in families.
And when we talk about family planning, and you've also mentioned there are other methods that make you thin, others make you fat, others make you be on your menses throughout. Like are people taken through some sort of screening, or what is done for someone to be
To know which one
this is the method that you're supposed to use?
We have a wheel where we check, it is a criteria, a medical criteria, where we check the conditions of which maybe if I've gone there for a specific family method, maybe I want injectable depo. And my condition, the medical condition, maybe having high blood pressure. Someone with high blood pressure is not supposed to get specific, like the depots, the implants, yeah. So those are the things that we use, but we do not do the medical investigation. What we do is screening through the medical criteria. Yeah.
So like the way my colleague is saying, if you have diabetes, if you have hypertension, so long as it's controlled, you can use the method. And if all these methods are not suitable for you, because these methods have hormones, so you're putting more hormones in your body, and already your body have hormones. We have others which do not have hormones, totally do not have hormones. So you can
Just
go
to interrupt, for the benefit of our viewers, can you just give us the examples? Like, let's say we have depo, we have this, and this is how it goes and all that, for the benefit of our viewers.
Okay.
And also for our benefit.
Yeah, we have examples that we can show you. Yeah.
Wow. Let me help from this side.
So we have different methods of family planning. I don't know if, we have different methods of family planning. We can see from top to bottom. So at the top here, we are talking about natural family planning. Natural. You just go natural. And natural, you cannot do it alone. You have to involve your partner. And natural, you use your dates, you use the calendar, you'll count your menses. Inaanzanga lini? Is it regular? When is it coming back again? So you can use the beads, or you can just use the calendar. You circle the calendar, unasema nilianza mwisho wangu sijui siku gani, date 12. So you'll expect it next month, date 12 imekuja. Yeah?
So like this is date 12. Then you can't.
So there's an arrow. There's an arrow where you're going.
So the red is the arrow.
So the red is your menses. You know, having your menses. It is red.
Start date.
So this means you're safe. You're very safe.
So immediately after your menses, you're safe.
You're very safe. So you move with this ring. There's a ring here. But the moment you reach white, you will get pregnant, my dear.
So this is
Ovulation
period.
Yeah, very fertile.
But this one we use it for those who are their menses are regular.
Yeah.
So you start with the calendar. You'll be checking your calendar first of all. When did my menses come last month? Is it regular? Did I see it on this date? That's when you can use these. Yeah. We even have the you check your during the menses the fluid. Ile maji, the discharge. You check it. Kai, watu wajifunze kujijua.
By the way, nowadays, I have an irregular flow, and I monitor my menses using the color of my discharge. I can tell that when I'm on my ovulation, it's whitish. I don't know if that's correct. It's whitish.
Whitish. Okay, when you're on your ovulation, it is clear.
Clear. Because I normally know that before my menses, there's the whitish discharge.
There's thickness.
Yes.
There's the consistency. Yeah. When it's clear inakaa kama maji, usijaribu tapata pole.
Okay, now I can swim because I know that there's the fertile discharge and the non-fertile discharge.
Yeah.
So maybe I'm confused in between the fertile and the non-fertile.
Okay, if you are very clear, that one you're very fertile. Very fertile. But inaendangiki kwa thicker and thicker. It doesn't mean that you will not get pregnant. You may just get pregnant. But ikifika ile there's that discharge and then it's white and then it's thick. that is the time you cannot get pregnant, and you are almost going for your menses.
Okay,
Yeah.
okay, now I get it.
So the next time we have condom, I didn't manage to get the female condom. Saizi we do not have them in the facilities. So
Can
the
I
male
remove
condom,
it?
then you can just remove it. So condom is, we usually say, is the best family planning for anyone out there. The best. STIs you will not get, HIV you will not get, pregnancy you will not get. It is an umbrella. You will not get anything so long as it is worn appropriately.
I wish we can demonstrate that. Next time, I promise you we will demonstrate. Don't worry.
It has to be worn appropriately. Those who've seen condoms, I'm sure we've all seen condoms when it's opened. Yeah? There's usually that kashap part. When you hold it like this, there's that kashap part. You pinch it. And usually encourage women, put it on for your man. Yeah, don't make it. It's also that part ya kufanya nini. It's like a foreplay for him also, yeah? Unamvalisha. You make sure you pinch it. Utaki mimba. You pinch it. Then unamvalisha vizuri ikienda chini, yeah? And then hapo patabaki na space. It will allow the sperms when he's ejaculating. The sperms zitaenda kwa hiyo space, then it's okay. But akivaa tu wewe ndarua na meno. This thing is not being torn by with the teeth. You have to use your hand. It is easy to rarua it. Ni rahisi kabisa. So just use your hand, your fingers, unakata, unatoa pole pole, you put it on for him, make sure there's that space, then you continue your thing. Yeah.
Nice.
Then
Let me help you.
alright. Then we also have the injectable depot. Right now we have two. We have the intramuscular. Let me show you. When I talk of intramuscular, I mean that you inject it directly deep in the muscles. Yeah. Then we also have the cyana. This is also depot. But for this, the advantage of this, even the client herself can inject herself once she has been educated or told on how to do it. Then the difference between the two is that this one, you inject here, the deltoid muscles also, and the gluteal. But for this one, you can even use it here, around the navel, yeah, and even on the thighs. So this one, you give it 3 monthly. After every 3 months, the mother goes back to the facility, yeah. And then we have the pills. So these ones are taken on a daily basis. Yeah. So you find a mother who she has delivered and now she wants to protect herself from getting pregnant before the other baby gets
She has
older.
just been she's from delivery.
Yes. This one. She's from delivery, but you know, women, we have hormones, yeah, and we also have hormones that manages the libido.
Okay.
Okay, when these women after delivery, libido wanga inapanda juu. As much as you will tell them, Aujapona, do not engage in sex. Watagoja because libido imerudi. So they have to have a family planning method. So the two, ina depend ni gani. There's one before the child reaches 6 months.
This one.
Yes.
Yeah.
And there's the one you start when the child reaches 6 months because of breastfeeding purposes. There's one which makes the milk inapotea. Maziwa inapotea. Mtoto apati maziwa tena kwa mwili. Kwa mama maziwa yake inapotea, so the child will not get enough milk until 6 months. Yeah. That's why we have the 2 pills there.
Okay, so I have a question hapo kwa hiyo pills na what is the duration for a woman who has just given birth to go into now having sex? Because I recently fumbled upon a video on the internet, and it was talking about how women who have just given birth are normally recommended not to engage in any sexual activity, not because hukuchini, like they gave birth and maybe it's still painful like Jahil, and it's because the uterine linings are still have been worn out kidogo. I don't know how true this is. Have been worn out, and it's very easy for them to now get an infection, which now leads to, was it sepsis? Is that information correct?
It is very correct, yeah. Because when a woman gives birth, during labor, the uterine walls, they tend to contract, and then that is the reason why we do tell them to give her at least some weeks before she engages herself into intercourse.
During delivery also, the uterus itself, it carried that baby. It was bulky. Maybe uterus ilikuwa kubwa, it has to go back to its original state. There's a lot of wear and tear during delivery. A lot of things happen. So you cannot just get pregnant again. Maybe you'll have an abortion after that. That child will not even survive. And sepsis that they had talked about. It is very true. Yeah. So we give them time. And for those who have men who will not wait for that time to elapse, we encourage them to do what? To get family planning. We usually call it postpartum family planning.
That is done within 48 hours post-delivery.
And just towards that direction, I'll need you guys to clarify something. You said there are those that they give birth and they are men. They can't wait for them to heal fully. And just as Christine has said, I also came across something on the internet which I need clarity with. And many women say, mabwana wanahanya, like they go outside and clarify on that as well.
It is true. We usually give women at least a grace period of 6 weeks for them to heal properly. And that is the time we usually say, if he can wait until that time, the better for you. But the women will feel like maybe the men are going out there again. They will just give in because they don't want the men to go out there, forgetting their health.
So they're using that just as a defensive mechanism. But in real sense, women are suffering because the moment now you've not healed, your uterus has not healed, and then the man wants you to get into intercourse, meaning the possibility of getting another pregnancy is there. Remember, psychologically, mentally, you are not fit. You've not healed completely. And if you have another baby before the one that you had previously grows up, it means that even the well-being of this baby won't be good. The reason as why we are doing family planning is to space the children. By spacing the children, they get whatever they intend to have in life.
So before, I don't know whether we are going to talk about this tool, but before we do so, or should I bring what? Yes. Or before I bring whatever I want to say, can we just finish with this one?
Thank you. This one is an implant. It's also a family method, and it goes for 3 years. Yes. So it's inserted beneath your skin. Depending on the hand that you're using. The one which is dominant. If you're right-handed, then you insert it on the left. If you're left-handed, then you do the same here. And just as we said earlier enough that we won't insert everything. No, we won't insert everything. There is something inside here like a rod, right? It's kind of a rod, So this one is just an applicator, like it's help us to insert whatever is inside here. Note that this one is going to be on your hand, not really. And just as we said that the family method, they vary with an individual depending on the hand. You find that some mothers, they will tell you that they don't want to use the implant for 3 years or 5 years. Reason being, someone else who is a friend, who is a neighbor, told them that whenever I use this, my body fattens or I have menstrual bleeding that is irregular and all that. So you have to educate this mother and tell her that it varies with an individual depending on their hormones. That is when after she uses, she'll know whether she is fit for it or not. And also we have what we call like when she comes with such side effects, there is a solution to each and every side effect. Yes, it's not that when she's experiencing heavy bleeding, you leave it at that point and tell her, no, you just have to lose weight. No, we have solution to every. Yes.
So back to this. Once inserted, is it painful when you do your day-to-day activities? Like how does it work?
It's not painful as such. Before we do the application, the insertion, we have the anesthetic solution, ligno, we call it lignocaine. So with that, it will make your skin to be a bit numb or something, so you won't feel any pain when you insert it. And the same applies to during removal. And whatever you're saying about the daily activities, we encourage the mothers not to do very extraneous activities within the first 7 days, because when we've inserted the implants, we'll have a broken skin. So if you intend to carry maybe heavy things, it will be easy for it to fall apart or fall down. But we don't just leave it at that point. We always dress it up. Then we encourage you to leave that dressing for at least 5 days. Yes.
Because it's talker.
So once inserted, how long is someone supposed to wait before they have that sex without getting a kid, or is it immediately?
For the implants, it's 24 to 48 hours. For implants. But for depo, the injectable, these are for 3 months, it is 7 days. If you inject it today, then you have to wait for 7 days before you engage into intercourse. Or if you want to engage into intercourse, then you have to use a barrier, where you can use now the condom that we showed you. Yes.
Well understood.
Okay. I've just seen you guys standing out towards me. Now, when this, is it an apron or is it an overall? When this whole bag was being opened, at the very top, there was Postina 2, formerly known as P2.
Sorry.
And with this, our generation, imegeuka Panadol. Imekuwa njugu. Is it Sunday or Monday morning? Someone is taking P2. And I hear that it has side effects to the lady, because you're not supposed to take it on a weekly or on a daily basis. So could you kindly elaborate on that?
Well, okay, Postina 2, it was brought as an emergency pill. It's an emergency. What do you mean by emergency? Emergency kwa kila siku. Emergency is never daily. So the moment you put it like it's a daily thing, maybe every weekend you'll be using Postina 2, in future you will have problems. In future, you will have problems. Getting pregnant will not be easy. Your menses will never be okay again. They will be irregular. They said that you should only use it like twice or once in a year. But the moment you start using it daily, what are you trying to do now?
But this generation, tell them.
Its hormones are so high, They mess with your menses, and in future you will have problems, maybe even getting pregnant.
And speaking of emergency pill, are PrEP and PEP pills also emergency pills? Or
well, they are not emergency. How are you people? Listen to me again. They are not emergency.
Okay.
PEP, you use it when you've had unprotected sex and you don't know the status of that person. Then you go for PEP. And there's a procedure. The moment you go through all those procedures, utakuwa unameza PEP kila wakati. The proper procedures, what ile story unakuja alafu nakupatia kisiri. When you go through the procedures visit, you will not use it again. And they have side effects, very terrible side effects. and you have to use it for 28 days. You should not engage in any sexual intercourse during those days. That time you cannot. So before and after, before you tested for HIV, after you tested for HIV, it is not confirmed that you will not react to HIV because you didn't know the status of these persons. And then when we go to PrEP, PrEP ndo maneno. PrEP squeezy, everyone is using it. Maybe I'm also even using it and you don't know. PrEP, you use it as long as exposure is still there. Yeah, this person will use status yake, but you love this person and you usually engage with him. So use it as long as, hata kama 2 years, 3, use it as
Continuously.
So just using your wrist, just like any other person, continue. That is PrEP.
So it's like your life now depends on. So this, so PrEP are the ones that are mainly used by. Am I allowed to say it? Because I know you know what I'm about to. Are they called key populations? Yeah.
Okay, they use PrEP. Even they use PrEP. They use PrEP and PrEP kuna styles nyingi. PrEP should be a topic on its own. PrEP there are different ways of using it. There are those people who use it continuously because you live with that person who you're exposed to. Maybe you're sure this person is HIV positive. You will use PrEP throughout. And if you break up with this person, you'll use it again for at least 2 more weeks. Kama hauna yeye, you broke up. So you're done with that person. So unaendelea kumeza for at least 2 more weeks. And then maybe unaenda tu kumtembelea tu. There's that criteria 1 to 1. Unameza kamoja before 24 hours, unameza 2, then utameza kamoja. Ulienda kumtembelea weekend, si ndio? Una anticipate, unaimeza kwa katembe kamoja, jili you are anticipating this person, si ndio? Ukiwa na yeye unameza 2. And then ukisharudi, uko barabara unarudi wherever, unameza kamoja. Sawa. But PrEP on its own, it's something that needs to be talked about broadly.
So for the IUD, the so-called coil, if you've ever heard of coil, so we have the hormonal and the non-hormonal. So for those people who have issues with hormones, issues with medical status, they can be given the non-hormonal. So the non-hormonal that currently having goes for 10 years,
Wow, that was really informative. And at least we've got an idea that some of these family planning methods are contributing factors to sexual assault and all that. And that was really informative. Just as we wrap up everything, just tell us the world you want to see maybe in the next 5 years or maybe in the next 1 year in terms of sexual and reproductive health in Kenya or maybe in Kisumu, and Christine maybe within the community we work in.
All right. In regards to sexuality and reproduction or reproductive health, we wish that in the near future, maybe 1 or 5 years to come, all our teenagers, the children, the upcoming children, they should be educated more on the sexuality and reproductive health, so that some things like STI, the sexually transmitted infection, the HIV, the unplanned pregnancy should not be there. Because the reason as to why we are experiencing such is because some people have got the taboos, the norms, the cultural norms, the beliefs. At least if there is a place where we can have that education, empowerment, access to health facilities, friendly, youth-friendly facilities or services, we can help them so that they don't feel like the privacy is not there. If someone has something to express and then she feels that there is a breach in privacy, automatically he or she won't step there.
True. So in the next 5 years, what I'd really wish for, it's our young girls and the women at large to be empowered. To be empowered in their sexuality, their orientation. They must know what they want in life, what they do not want in life, and that they should be able to walk in any facility and know what they want what they want to get from that facility, or they can even ask questions openly to get assistance from it. The STRs and HIV again, it will really help when they are empowered. It will go down, and they'll open up when there's a problem early enough. They'll not even wait for the problem to be so big. Yeah.
For me, in the next 5 years, I would love to see a world where youth make a lot of, make more informed choices in regards to our sexuality and our sexual reproductive health, proper information in the community level, and let's just destigmatize anything to do with the sexual reproductive health and rights that are myth-related, stereotypes, and everything that just hinder people from accessing these services from the facility. And also, we need to normalize going to the facility and asking for these services without necessarily having a problem. Yeah.
Yeah, so that is all from us. Don't forget to share, comment, and subscribe for more exciting podcasts. Bye. See you next time.
Bye.